Hello, I'm Dr. Laura Pack, and this is a Society for Vascular Surgery briefing about how to introduce yourself and your medical services to a new community. As a fellowship-trained vascular surgeon, your skills are a valuable resource to the community for the surgical and non-surgical treatment of arterial, venous, and lymphatic disorders. Vascular surgeons are uniquely trained to offer comprehensive care for the patient with vascular disease. Your fellowship training in the modern age of vascular surgery gives you unparalleled expertise in patient evaluation and screening, medical management, modification of risk factors, and vascular imaging. You are proficient in the latest minimally invasive technologies as well as open surgical techniques, which allows you to tailor-fit a treatment plan for each individual patient. You offer a patient and a referring doctor a balanced view of current treatment options and long-term follow-up to optimize outcomes. Your community referring physicians need to understand that by sending a patient to you, their patient will receive the very best in vascular care, including evaluation, risk modification, endovascular treatment or open surgery, and follow-up. Now, you need to get the word out. Start your introduction to the community by beginning an advertising campaign. First, assess your market. What aspects of vascular surgery could be improved in your community, and where is there room to introduce new technology? Try to identify a unique niche that only you can fill and sell it. Dialysis access is a bread and butter business line for a vascular surgeon, and frequently communities have need for expertise in this field. Introduce yourself to the nephrologists in your area. After your first couple of dialysis cases, go visit your patients in the dialysis unit. Get FaceTime with the nurses and technicians and offer to take emergency calls for their urgent access needs. Bring business cards and offer to make a presentation to their dialysis support group. Introduce the idea of routine surveillance for fistulas and grafts, and educate patients and physicians on percutaneous technologies for graft salvage. Because you treat both arterial and venous disorders, you're an essential partner for any wound care clinic. This is an excellent source for patient referrals. Go to the wound care clinic in your area and meet the nurses, therapists, and physicians. Offer to do a clinic day in their facility to evaluate lower extremity wounds. Partner with your local vein product representative and make a presentation to the clinic on venous stasis ulcers. Introduce them to the idea of minimally invasive vein ablation techniques for the treatment of stasis ulcers. Take before and after pictures with your first limb salvage, vein ablation, and sclerotherapy cases to help advertise your work. The non-invasive vascular laboratory is essential to the function of a vascular surgeon and is also a way to educate physicians, attract referrals, and expand capabilities. If there is a hospital-based laboratory, insist on being involved in the administration and interpretations. Interact personally with the vascular technologist so that they know you are happy to act as a resource as well as a referring choice. Vascular surgeons see many urgent medical problems, and many hospitals have stipended vascular call schedules which you can participate in and which will allow you to increase your profile in the community. Also, think about presenting an update on vascular emergencies to the ER physicians and staff at your hospital at their monthly division meeting. Show them recent advances in technology that they may not be familiar with, like endovascular aneurysm repair, carotid stenting, and mechanical and TPA thrombolysis for DVT. They are the gatekeepers for many referrals for urgent vascular problems, and your introduction to them solidifies your stance as their #1 vascular specialist. Some of the most effective ways of getting your name out to community physicians is to lecture at a hospital grand rounds or local physician educational seminars which offer CME credits to discuss topics of interest to you or an area of your practice that you wish to grow. Frequently, industry will help advertise and sponsor a dinner event. For instance, a talk you give to podiatrists on new technologies for treatment of critical limb ischemia. Podiatrists in particular can be a rich source of referrals and should be actively sought out and partnered with. You can also offer to host a lunch event in a referring doctor's office. This gives you one-on-one contact with the staff and physicians during the normal workday and allows them to meet you personally. Or you can volunteer to give an in-service lecture to hospital nurses and technicians. This will not only help to improve the level of care provided to the patients in your hospital, but also opens the door for a new potential referral source. Every nurse or technician is asked medical questions by friends and family, and they will think of you when they need a doctor for their vascular problem. Community outreach is another successful form of advertising. Many elder care centers, gyms, churches, synagogues, or service organizations such as Rotary Club host guest speakers. Bring handouts so attendees can have a take-home reminder of your talk to discuss with their neighbor at dinner or their physician at their next office visit. You can also offer a free screening day for varicose veins or PAD. These events will bring new patients into your practice. Several product companies can offer free educational handouts, videos and posters, and manpower to help staff these events. Local newspapers and TV stations frequently have an Ask the Expert advice column, which you can offer to contribute to. Many will run a human interest story on you if you provide a service to the community or if you bring a new technology to their local hospital. Listings in the business section of the Yellow Pages are helpful, but online listing of your practice website will likely reach more people. Local magazines and radio stations also offer opportunities for advertising. In your first years, you can expect to spend about 5 to 10% of your gross practice income on advertising if you are in a competitive market area, and 1 to 5% if you're in a less competitive area. Budget for this. Building a foundation for a successful and sustainable practice takes not only dedication to patient care, but also some basic business acumen. Demonstrate and advertise that you are a leader in your hospital, a citizen of your community, and a professional in all aspects of your work, and you will establish yourself as the local center for vascular excellence. This briefing is made possible by a grant from Cook Medical. To learn more about vascular health careers, visit vascularweb.org.